How to revive hair that thins, grays, or gets out of control as you age. How to revive hair that thins, grays, or gets out of control as you age. Hormonal shifts, which affect women more than men later in life, may play a role in hair thinning and graying. The ways in which hair changes as we age aren't always welcome, nor are they entirely within our control. Many changes men and women see in their hair are thought to be the result of reduced activity of the stem cells in the hair follicle. As we get older, those stem cells, which replenish tissues throughout the body, don't function as well or as quickly as they used to. To effectively revive hair that thins, grays, or becomes unmanageable with age, a combination of dietary adjustments, hair care practices, and lifestyle changes can be beneficial. Here are several strategies based on expert recommendations. Dietary considerations. 1. Balanced nutrition. A diet rich in vitamins and minerals is crucial for hair health. Focus on foods high in zinc, like oysters, omega-3 fatty acids, found in salmon, and protein. These nutrients support a healthy scalp and promote hair growth. 2. Hydration. Staying hydrated helps maintain the moisture levels in your hair, preventing it from becoming dry and brittle. Hair care practices. 1. Gentle washing. Reduce the frequency of washing your hair to prevent stripping it of natural oils. Aim to wash it at least twice a week, using a mild shampoo. 2. Conditioning. Always use a conditioner after shampooing to replenish moisture. Consider volumizers to add body and strength to thinning hair. 3. Natural remedies. Applying natural oils like coconut or olive oil can help restore moisture. Aloe vera gel and rinses made with rosemary extract are also popular for reducing thinning hair. 4. Scalp massage. Regularly massaging the scalp can enhance blood circulation, which may stimulate hair follicles and promote growth. 5. Low pH products. Switching to low pH shampoos can help balance the scalp's acidity and reinforce hair health. Styling tips. 1. Avoid heat damage. Limit the use of heat styling tools as they can exacerbate hair damage. If necessary, use a heat protectant and keep temperatures low. 2. Regular trims. Getting hair trimmed every 6-8 weeks helps maintain its health by removing split ends and promoting a fuller appearance. 3. Choose the right haircut. Shorter styles or layered cuts can create the illusion of volume, making thinning hair appear fuller. Lifestyle adjustments. 1. Manage stress. Chronic stress can negatively impact hair health. Engage in stress-reducing activities such as exercise, meditation, or hobbies. 2. Consult a professional. If hair thinning is significant, consider consulting a dermatologist or trichologist. They can recommend treatments like minoxidil or investigate underlying health issues. 3. Hair color options. If graying is a concern, consider semi-permanent or permanent hair color to enhance shine and volume. Professional application is recommended to minimize damage. By implementing these strategies, individuals can better manage the changes in their hair as they age, promoting healthier and more vibrant locks. Reviving hair that becomes thin, gray, or difficult to manage with age involves a combination of precautions, proper care, and targeted treatments. Here's a comprehensive guide. Precautions. 1. Limit chemical treatments. Avoid frequent use of chemical dyes, perms, or straightening treatments, as they can weaken hair and accelerate thinning. 2. Minimize heat exposure. Reduce the use of blow dryers, flat irons, and curling wands. Excessive heat can damage hair shafts, making them more prone to breakage. 3. Handle hair gently. Avoid tight hairstyles that pull on the scalp and can cause hair breakage. Opt for loose styles and use soft hair ties. 4. Be mindful of sun exposure. Protect hair from excessive sun exposure by wearing hats or using hair products with UV protection. Hair care. 1. Maintain a healthy diet. Include foods rich in proteins, iron, zinc, and vitamins A, C, D, E to nourish hair from within. Hydrate adequately to keep the scalp healthy. 2. Use gentle hair products. Choose sulfate-free, pH-balanced shampoos and moisturizing conditioners. Avoid harsh chemicals that can strip natural oils. 3. Regular scalp care. O. Scalp massages. Gently massage the scalp with natural oils like coconut, argan, or jojoba oil to stimulate blood circulation and promote healthy hair growth. O. Exfoliation. Use scalp scrubs or gentle exfoliates to remove dead skin cells and maintain a healthy scalp environment. 4. Condition and moisturize. O. Use a deep conditioning treatment or hair mask once a week to retain moisture and prevent dryness and breakage. 5. Avoid overwashing. O. Wash hair 2-3 times a week to prevent stripping the scalp of its natural oils. 6. Reduce stress. O. Practice stress management techniques such as yoga, meditation, or breathing exercises, as stress can exacerbate hair thinning and graying. Treatment. 1. Nutritional supplements. O. Consider supplements like biotin, collagen, omega-3 fatty acids, and multivitamins, especially if you have deficiencies affecting hair health. 2. Low-level laser therapy, LLLT. O. LLLT devices can stimulate hair follicles and encourage hair regrowth and thickness. 3. Medical treatments. O. Monoxide, Rogaine. A topical treatment that can help stimulate hair growth in both men and women. O. Finasteride, Prophecies. A prescription medication for men that can slow hair loss and promote regrowth. 4. Platelet-rich plasma, PRP therapy. O. PRP therapy involves using a patient's own platelets to promote hair growth by enhancing hair follicle function. 5. Microneedling. O. A minimally invasive procedure that can help stimulate hair growth by increasing collagen production in the scalp. 6. Hormone therapy. O. For women experiencing menopause-related hair changes, hormone replacement therapy, HRT, may help balance hormones that affect hair growth. 7. Natural remedies.
O. Onion juice, aloe vera, and rosemary oil. Natural ingredients like these have been shown to promote hair growth and improve hair health when applied regularly to the scalp. Conclusion. Hair thinning, graying, and unruliness with age are natural processes influenced by genetics, hormonal changes, and environmental factors. While these changes are inevitable to some extent, taking precautions, adopting a healthy hair care routine, and considering targeted treatments can help manage and revive aging hair. It's important to consult a dermatologist or trichologist to create a personalized hair care plan that suits your needs. With the right approach, you can achieve healthier, fuller, and more vibrant hair even as you age.
The information provided here is intended for educational purposes only. It is not a substitute for professional advice and should not be construed as such. The content is based on general knowledge and may not be applicable.
Thanks for watching. Like, comments, and share.